With no sign that COVID-19 infections are abating, the country's medical personnel are bearing the brunt of the pandemic. Reports emerging regularly of doctors and nurses unable to treat their patients the way they'd like to. That's because of overcrowding and sometimes a lack of beds and medical supplies. I'm joined by Kwena Manamela from the Democratic Nursing Organization of South Africa. Mr. Manamela, thank you very much for your time here on eNCA. Now, of course, we can see ourselves as the Department of Health releases the daily statistics about the number of infections and deaths that we're recording in South Africa, that things are bad. What are nurses and doctors telling you on the ground?
Good evening to you and the listeners at home. Indeed, you are correct. The nurses or the healthcare workers or the frontliners out there, they are frustrated, they are exhausted, they're fatigued because of the COVID-19. As much as the cases are escalating or are increasing on a daily basis, it's frustrating to them knowing that very little will change. They will remain with what they know, what they have for several days, if not months to come. Because we thought by this time, since the pandemic started in March this year, or since the state of emergency or of disaster was declared at the beginning of last year, we thought by this time we'd be very far understanding exactly what is it that we should put in place as a country and what is it that we should be done. But it looks like we still, the department or government is still beating about the bush on a number of issues, on how to deal with the issues. Because to give you an example, we're still where we are in terms of the infrastructure of the hospitals. Very little has changed. We're still having lack of equipment. We're still having leaking hospitals. The list goes on. And now, to put salt to the wound, is that now the issue of overworked, shortage of staff is now worse as we speak.
And I can imagine, Mr. Manamela, the fact that healthcare workers themselves are testing positive for COVID-19, some of them even losing their lives. I can imagine that this is exacerbating our problem in South Africa. And would it be fair to say that our healthcare system is on the brink of collapse?
Yeah, my response to that is that you are right. The frustration that I was talking about is that at work, there is very little to use in terms of equipment, not least to say the support that they are getting from the employer. And when you get home, you get into a public transport. When you get into the transport, maybe the commuters are not adhering to the guidelines. You get home, you are fearing for the lives of your family. On a daily basis, you get condolences. You are next of kin. You're lost of kin, and so on and so on. So where we are heading to is really a challenge, because, as I said, the number of cases are escalating, but there is very little that is going to change. Things are remaining the same. Worse is that the budgets have been cut. We can't, or government is complaining that they can't increase the number of staff that is there, whereas we are losing a number of the frontline workers that must take care of the patients. So it's really a dire situation where we are, and it's frustrating to the workers that goes to work every day. Yes.
I'm listening to your tone, and I get a sense that healthcare workers and organizations and unions such as yourselves have given up. You've given up. You're just doing what you can every day, but you have no confidence in the government, and you've given up.
We're trying all we can, because we're trying to engage governments from all levels, because like I said, from the very basic, from the institutional level, we're discussing with government to say maybe if those structures that are there, that have been put in place, your occupational health and safety committees, they must help monitor the situation on the ground, the stock levels and that, so that the report that we get, if there is any problem that arises, we are able to get it quickly so that it is resolved quickly. But if those structures as well, those that will help the regions will help the provinces, and at the end, it will help national to create an informed decisions. They are not used. Then it creates a problem. But we have not given up where we are. We are trying all we can to engage government in all the spheres that we can.
Now, let's talk a little bit about the vaccine. Hearing the president, for instance, when he announced that we'd be moving to the adjusted level 3, saying that we are only likely to get a vaccine in the second quarter of the year. The health minister in the past few days has been trying to also speak about how they're trying to fast track that, but experts are saying there has been no formal indication of the vaccine coming. How do healthcare workers feel about this? Because I'm sure they were hoping that they'd be the first to become vaccinated because they're in the front line.
Yeah, I think there are mixed feelings amongst the healthcare workers, especially around the issue that you're talking about of the vaccine. Because where we are sitting, there is lack of information. We don't have much information around the rollout strategy on the vaccine issue and how and who will be prioritized in that respect. We still have to engage and hear and see the plan, how the vaccine rollout is going to be. Because where we are sitting, we don't even know when will the vaccine arrive and how much population will be covered by what will be procured, and so on and so on. So in terms of vaccine, let me say there is very little information that we have from our side.
Just my last question, just describe to us some of the scenes that your members have, for instance, told you about at hospitals. Are they saying that the hospitals are too full, there are no ventilators, or are people simply passing away from their homes?
The information that we are getting is that hospitals are getting fuller and fuller by day. And I think the active beds are getting full. Available beds, I think they're getting slimmer and slimmer on a daily basis, and also impacting on other diseases as well, because it's not only COVID-19 patients that they're taking care of. There are other patients that they're taking care of. So it's really frustrating because the beds are getting slimmer and slimmer on a daily basis. But maybe just to add to that is that even if the beds are increased at any institution because of the load that they have or any other province, the issue that we have is that the staff is not increasing. The number of patients are increasing on a daily basis, but the number of staff is not increasing. So that's the frustration that is there. Like I said in the beginning, that knowing that very little is going to happen is really frustrating to them, and it's really exhausting to the healthcare workers, knowing that there isn't much. And I also stated the issue that the issue of the budget cuts, I think it had a huge impact on what they use on a daily basis and the number of home bodies that should be there taking care of the patients on a daily basis.
And of course, there's also the argument of the salary increments, the fight therein, and some healthcare workers not having taken a break since March 2020. But I have no more time, unfortunately. Kwena Manamela, thank you very much for your time from the Democratic Nursing Organization of South Africa.